Oh, we did it.
Okay.
Well,
It's okay, so we got our remote to work.
yay.
Okay.
Game changer.
Well, something that's been on my mind lately are diagnostic tests, specifically MRIs, CT scans, but especially MRIs. So a lot of times somebody will get hurt and they will call us and say, well, they did x-rays and the x-rays were normal, so I got released. And they'll say that about, a strained sprain or a fall, where we know there wasn't a broken bone, but they will get an x-ray at the emergency room because hospitals love to give x-rays. And then they'll go along and they'll treat with a doctor. And then what'll happen oftentimes?
What will happen when they treat with the doctor?
Yeah, with that first doctor.
Well, they'll do an evaluation. They'll tell them to do PT for several weeks. When PT doesn't work, then they'll want to do cortisone shots. And when the cortisone shots don't work, then they'll finally do the necessary MRI and decide whether or not the client needs to have surgery.
But oftentimes they're treating with that first doctor and going to loads and loads of PT, physical therapy, without ever having an MRI. And they're just sort of, hoping it's going to get better without an MRI. And that happens because the insurance company is paying for treatment and MRIs are very expensive.
They want to keep the cost down.
Yeah, so let's say you have a knee injury and, you twist or you pivot wrong or you fall to the ground. And clearly you didn't break anything, but you've got pain and weakness in it. You'll go to physical therapy for all this time. A lot of times people come to us and say, they released me, they let me go. And the very first thing we do is ask, was there ever an MRI? In fact, Cassie will get off the phone with a new client and she knows I'm going to ask that, don't you?
Yep.
So now you ask it, don't you?
Christine answers a question with a question.
I always answer a question with a question.
And you never know the answer to it.
Don't I?
Yeah.
Isn't that true?
It certainly is. I have to agree on that.
So most of the time, if your knee is not getting better, we will not want to settle any case before there's an MRI because you just don't know what's in there. X-rays show bone. They might show some degeneration and some arthritis, but they're not going to show a meniscus tear, which is in the knee, or a shoulder injury, which is oftentimes what, Cassie?
Torn labrum.
Torn labrum. I don't know why Cassie loves torn labrums.
Because I can diagnose them.
Yeah. You kind of get to where you feel like you can, don't you?
Well, yeah, I've called them a couple times. 2 times.
You were right.
That's huge.
Yeah. So if you are in the course of treatment and your symptoms aren't getting better and you haven't had an MRI, that's when it's time to call us. MRIs are also helpful for the back. So back, shoulder, knee, ankle, elbow, and especially for lumbar or other spine issues, neck, thoracic or middle of the back or lumbar spine, because those will show things like herniated discs. So if you have a back injury and you have symptoms going into your leg, that's a pretty serious issue. You definitely need an MRI for that. So what would you say? Wouldn't you say most of our clients, when they call us, they still haven't had an MRI?
Yeah, like 80%.
Yeah.
And the possibility of, or the probability of them getting workers' comp to give them one of those without representation is about 8%, probably lower.
Yeah, it seems like once we get involved and we speak to the attorney for the employer and we say, hey, there wasn't an MRI, they go, oh yeah, you're right. We probably should have given him an MRI. But
because they knew it all along.
Yeah. They just hope that you're going to, give up before you get one. So diagnostic tests. Wow.
Or texts.
Or texts. MRIs, super important. Anything else on MRIs?
Nope, that's good.
Let's see if our remote works to turn us off.
Oh, yeah.
We're having problems with our remote, guys.
We'll get you an MRI.
All right.
Nope.
I'm going to have to lean in.
It's not working.
Thanks, guys.